Today, we're doing a quick clinical judgment inspection. Because if post-conference turns into a story time, you guessed it, we're missing the point. Welcome back to Nursing Quest. I'm Nurse Amanda, your educator and consultant in nursing education. And today we're going to talk about how to run a post-conference in a way that actually builds clinical judgment. There's plenty of articles out there that are readily available that we can see a trend where new nurses are leaving the bedside at an alarming rate. So I'm choosing to discuss this essence of running a post-conference. If your post-conference turns into a long patient report or becomes essentially a vent session, or you leave thinking, we talked, but did anyone learn? This episode's for you. In the next 15 minutes, I'm going to give you a repeatable post-conference structure, and I'll share with you 6 published frameworks that you can choose from based on your facility's policies and procedures, your teaching philosophy as a nurse educator, and it's also, of course, based on what happened in clinical. Okay. Forgive me. So the purpose of post-conference, right, is for us to connect and make sure that we can tie along the clinical judgment set forth by the NCSBN to strengthen patient outcomes, because essentially it is all about patient safety. Okay. So we need to think, how do we make thinking visible? Okay. Strengthening clinical judgment, closing that loop. Oftentimes, as leaders, we hear about loop closure. Do we practice it? I'd like to say yes, but do we teach it? We have an opportunity there. So, closing the loop, so students leave with one clear improvement for the next time. If students can't finish the post-conference sentence, for example, next shift I will, then that sounds like a good recap, not essentially a lengthy patient report or elongated debriefing, if you will. Let's make sure we can connect, because now there's analysis of our current cohorts, students that are non-traditional, traditional students, of course. But I think one of the pieces of information that we keep seeing reoccur in literature is that we're seeing students with possibly shorter attention spans. We need to grasp their focus immediately. We need to help them connect these tools together, utilize the resources, but also we need to embrace the affective domain and teach them how to think and feel like a nurse. Well, hopefully we can even reduce imposter syndrome with that, but that's for another research topic. So let's say if we were going to structure this into something you can repeat every week at clinical, maybe say before we debrief, everyone, why don't we share a win from today? Whether that be skill, communication, confidence, anything that goes along those lines. You can structure the pace as you want. You can keep it fast or, slow it down. You're going to control that. But help them harness it into essentially one sentence so everybody gets an opportunity. Maybe you have a cohort of 10 that had 4 patients on an extremely busy ICU or med surg floor step down, depending on where you're at in the program and what type of pre or post licensure program you're teaching in. More than likely, if you're watching this video, you might be transitioning from clinical or bedside into academia in a pre-licensure program. But if not, all are welcome, of course, and enjoy, please. So you can further break up the frameworks of the day, right? And at the end of this video, attached with it, you'll see frameworks that I'm going to post, and they're essentially open access public articles that you can review to make sure it fits your teaching styles. So I encourage you to pick one framework and essentially pick 3 or 4 prompts. You don't need 10, you don't need 12. And we don't essentially need everyone talking for 30 minutes. Because then oftentimes in patient report, maybe if we're on, for example, maybe a med surg unit and we got 6 patients running, we're not going to get an hour to debrief the ongoing nurse for each patient. So we should teach the students essentially to streamline their information, and say, what needs to go with the SBAR and the communication preferences that's led by that hospital, and what's pertinent to the patient data report and ultimately the patient condition, right? So we need to teach them to structure their sentences in a way that would help elaborate on a busy unit, for lack of better words. You can also incorporate too a teach back, even if it's 2 or 3 minutes. If you're having a structured debriefing time post conference, okay, one thing you can do is incorporate a teach back. If each of the students essentially teach the group one thing they learned from today in under 3 minutes, that could be considered a win per se, and it can correlate to what actually happened with the patient, what was the interventions. They can essentially go through the nursing process without making it a long, elaborated report that could potentially turn into a venting session, like, oh, this nurse looked at me this way, that things that are not pertinent to the patient, right? And the ultimate care of that patient and safety. You may be wondering, well, how can I close the loop with them? Have them start structuring the way that they're going to end the post conference with next shift, I will. And that may be even tricky to do. For example, if you're going to say next shift, I will, next shift, I will look out for maybe it's a certain rhythm they're learning this week, right? Is it, tachycardia? What are they in a fundamentals course? Like, where are they? Let's meet them where they are. And that way we can structure the clinical learning with what they're actually learning in didactic too, to make sure that the program is running as the curriculum is written. And that speaks to accrediting bodies to help tell our story. And how do we take the information from didactic or theory connected to the skills that they're going to need to be validated on, to be checked off on, to work in the lab, what they're seeing in simulation so it correlates or connects. And then ultimately, what actions did they do with the supervising RN, of course, to take care of that patient? What actions happened? How did they utilize and think and critically think through the clinical judgment model, which is essentially um, the nursing process, right? So you can also ask your students, and maybe one way that we help them portray how to structure their critical thinking is, maybe they can say, well, one thing I'm reviewing tonight is, recognizing signs and symptoms of cor pulmonale. Okay, for example, right? Now that might be a concept eh, non-specific to what type of curriculum that you have, whether it's, competency-based curriculum, a constructivist approach to curriculum. I mean, we can do a deep dive in curriculum, but at least to follow the structure and flow of the program, to not deviate from their CSLOs or their course learning outcomes or even their program learning outcomes, to make sure all of this is structured in an appropriate fashion for the program, for their learning, to help support them. Okay. It's defensible, it's repeatable. It's not essentially that it's simple. There's nothing simple in nursing, right? It's everything, and this is just my opinion, can become complex. But when we simplify it for them essentially and structure the post-conference, this is where choosing a framework could help. So I'm talking about frameworks. How do you even choose a framework? Okay. So the night before your post conference or the morning before, day before, however you decide to prepare for your clinical, right? Your clinical day, first of all, what is the biggest learning outcome of the day? What are the learning outcomes for today? Do you have a structured approach to your clinical? For example, some clinical instructors choose to make their own tracker, to make their own matrix, if you will. And I can share that on the website with you guys too, thenursingquest.com. And I'll have that as a downloadable, what I'm talking about, referencing here. But it's a way that, example, how I've used this in the past, how you could use it is, let's say you have, I'm going to shift gears real quick to VN LPN, right? Let's say that they're in a fundamentals clinical and they're just now learning how to do bed baths, and you're going to do the buddy system, essentially pairing them up two at a time to take care of one patient in a pre-licensure program. It's an option depending on your leadership and policies, of course, right? Well, the matrix that I'll upload to the website is a way to buddy the students, track them, check and keep track of the skills they're supposed to learn, so we just don't go through the day hoping that whatever happens to us and we're going to deal with it. I understand that is how nursing can be, but in an educational mindset, whatever resonates with your teaching philosophy is how you can plan and choose to use these frameworks and choose to track and essentially train your students to collect data. And your program director, I'm sure, will love that. Anywho, back to this, how do you choose a framework, right? So if you feel that the clinical day is going to be rushed, maybe the site said, hey, I can't host you for a whole day. We have a visit. I won't say from what body, but we've got a visit today. You can be here for 5 hours. Okay, that sounds like a pretty time crunch day, or maybe even a mixed day. Not really sure how the day's going to go. You can use a plus or a delta framework, and I'll have these links for you too to reference here. If always safety is the concern, right? Protecting the public, protecting the patient. So, or maybe there is a professional issue that you want to talk. Maybe you're in a leadership course at a clinical with clinical hours assigned to a leadership course. It could happen, right? Maybe you can choose, the topic or framework of advocacy or inquiry, spirit of inquiry. A real popular framework is the Pearls framework. Again, the link is going to be down below. If you want something to grow clinical reasoning, maybe you've noticed that in clinical, the students, as they will, of course, right? They're going to hesitate, and that is okay. That says that, hey, they're thinking there's some sort of warning happening in their head. They're like, wait a minute, right? And they come and get the instructor, and then you provide that faculty-led clinical experience for them. But you can do, meaningful learning that way to where you want to blossom just on the clinical judgment model. That's fabulous. And that is okay. If you want to further elaborate on clinical judgment language, really, what is the NCLEX going to say? What's going to happen after the NCLEX to keep them on the bedside, right? Tanner's clinical judgment model, another set of framework. That is another framework, excuse me. If you want feedback aligned evaluation of the day, maybe the Lassiter clinical judgment rubric. Okay. There's a plethora of frameworks to choose from, but the goal is that's how you can use a framework to structure your day, so you're not going in blind and you're not winging it, right? In education, that's not okay. So let's talk about the plus delta, right? You can use this framework when you have essentially a time crunch, right? And you need some structure. You can structure. You can say, the plus is what went well today, and that's what we should keep doing if you're using this framework. The delta is, delta change, right? What needs to change next time? What will we do differently? Okay, because that's something where you can follow up with some prompts about, what's one behavior that we should repeat next week? Or what's one change that would reduce any risk? or confusion. Oftentimes, there can be confusion at clinical, especially if we don't provide the students with the structure. Nobody knows who's like nobody knows their role that they're doing unless we structure their roles. And so they're looking to us for that leadership. Okay. And you can close it out with the students in your pre-brief when you're planning all of this, or sharing the plan with them because they're looking up to us. We're their role model, right? You can say, this week the delta is going to become our plan, and the next shift, this is what we're going to do. You can shift frameworks depending on what you need. If you're going with a advocacy theme, or discovering a spirit of inquiry, like this is pretty helpful if you're going on a clinical observation. If you're setting up your students for clinical observations in the hospital, maybe they're rotating through the OR, they're rotating through wound care, IV. It just depending on how the hospital names those observation areas. Are they going to cath lab? Are they going to IR? Okay, so that's something. So this is great if you're going to do an observation and you want to understand what they're thinking. So one thing you can prompt them is, what did you notice? For example, the student may say, well, I noticed we gave the medicine before we rechecked the blood pressure. Okay, that's a flag, right? So the wheels are spinning. What steps could we have done here? Or maybe they could say in an advocacy theme, I'm concerned because that can increase the risk for hypotension. So you're essentially helping frame their mindset on the words that they're choosing. This is going to help with the affective domain, because if they can speak like a nurse, they're going to portray a nurse. They will be the nurse, think like the nurse, and essentially, get through boards and become a successful, safe, competent nurse, right? And then you can, ask things like, can you walk me through what you were thinking in that moment when you've seen or noticed that observation? Okay, what cues did you notice? What would you do first if that was you? What safety check would you standardize? Well, and this is where you can go into your safety checks of medication administration. This is where you can go into your rights of medication administration. Those are giant patient safety goals, and always thank them, right? Because the goal is learning and safety. Because again, this was used during an observation rotation. So this can really help. Okay. If we're talking about the framework of pearls, it almost gives you a menu, if you will, to keep the flow consistent. You can say something like, let's debrief using a simple structure, reactions, description, any analysis, summary. You can say something like, well, what's one word for today of how you felt? you know, have them describe to you maybe in 1 minute what happened today that mattered. Well, essentially almost every piece of the day matters as a nurse, but this is how you can help embrace the different frameworks that you choose, right? If we're thinking analysis as a part of pearls, what was your priority or priorities and why? How did you structure those priorities, right? That essentially, maybe you're discussing the topic of triage, okay? Is it in their scope triaging? Are they a LPN, PN, LVN, excuse me, PN or VN student, depending on the state? And this is where it helps to know your nursing, your NPA, your Nursing Practice Act, depending on what board you're governed by, right? You can ask things for analysis like, what data changed your plan? Was it a lab? Was it a critical value? What would you do differently next time? Right? Now, we all know real life as a nurse, sometimes you don't get a next time. So this is where the learning needs to be faculty led, and the faculty needs to be involved during each step of this learning process. Okay. You can almost think of it like a Maslow's hierarchy of needs if you want to go that route. But I'm specifically trying to stick to these frameworks today. And then you can ask, like, for example, a summary of what was the one principle that you're going to take with you into next week? What do you want to improve on? How do you want to, what's a skill besides a skill? Skills are essential and extremely important. But what's even more important is that critical judgment, the thinking, the framework of how they're piecing this information together. Because if they're on TikTok looking at what, another nurse is doing, are they a certified nurse educator? Do they have experience? What is the credibility of the resource? If you'd like to look up mine, please visit www.thenursingquest.com. I list essentially who I am on there. Again, if you've been following Nurse Amanda, 8 years in nursing education, also leadership, director of nursing, director of clinical education, associate dean of nursing, nursing faculty, clinical simulation, creating programs, opening new programs, running programs, frontline in the trenches at clinicals with the students, frontline essentially in the hospital too. When I was med surge, orthopedic, I tried ICU. Hats off to the ICU nurses. It was not my cup of tea, etc. Right? Um, and I have numerous allocates as well from the NLN is one certified academic nurse educator with a specialty in practical vocational nursing education. So academia is who I am and what I do, and I want to see everybody um, do well, be safe, and be competent too out there and share that knowledge. So anyway, back to the framework, right? So debriefing for meaningful learning, or a DML framework, right? You can use this when you choose to grow that clinical reasoning and do a deep dive essentially, or into clinical judgment. So leading with something like, we're going to focus on reasoning, not reporting today. So pick one patient moment that you had to help make a decision, or you observed the decision being made, because as student nurses, they're not going to make an independent nursing judgment because they're not a licensed nurse, right? So we need to make sure that they feel safe and competent as they're in their role as a student nurse. Okay, so that's essential, because if they're shadowing a preceptor or you're doing a faculty-led clinical, these are some of the major points that you can help prompt. You can utilize Socratic questioning here if you choose. So some of the things that with this framework you can do is, what you can use was, did you notice, or what was the decision point today? Get them to think and talk about what was going on at that bedside. What options were discussed either with you as a faculty or with the nurse that the student was shadowing or precepting with, depending on your model at your nursing institution, right? Were there options considered? Did evidence play a role into this? Because we should be following, and our students should be educated on that we do everything with evidence supported, um, evidence-based practice. Okay, so what evidence supported the choice? Was it lab work? Was it a critical value? Was it a change in cardiac rhythm? What happened? Okay. Um, Essentially, what were the outcomes for today? You can even tie this into a nursing diagnosis, and go into the whole NANDA right there with that one question. That's going to take you for a few minutes spin. And something that, if you can say things like, well, if you were the nurse, what would be your thoughts on what you would change the next time? Or what opportunities did we have? Did we seek all the correct resources? Because then this is where you could close out your debriefing post-conference and say, clinical judgment improves when we explain the why. Okay. This is how you help your students practice explaining our why. Okay. Because they're going to be future professionals. If you choose to utilize Tanner's clinical judgment model, this is certainly a popular one. There's many curricula that is written with the notion of Tanner's clinical judgment model as the guiding framework. This helps when you want a consistent language across all the instructors, which is highly recommended. And it's something not only that's recommended, but it's admirable too, because the program is speaking the same language. You're not essentially having your fellow nurse instructor go rogue, for example, and choose something completely different. Or if they have that, academic freedom to choose, like I mentioned earlier, the framework that they would like, excellent, do it. But make sure that you are following, of course, policy and procedure, any evaluations that are set forth by the program, because all this is turned into, it's oftentimes reported to the Board of Nursing, it's reported to the accreditors, you write to it, you own it, you speak it, you live it, right? So let's run through the 4 steps here of Tanner. So essentially, let's break it down even simpler into like noticing, interpreting, responding, reflecting, because when a student can notice, they can pick up on the cues that essentially were the most dreadful, if you will, or a student may think of it as, well, what's going to matter the most? Well, no, what's this? What could hurt your patient faster? Those are the cues you need to see first and take care of first, right? I'm preaching to the choir right now. Very passionate on this subject. So interpreting, you know, a prompt like, well, what do you think was happening? How did they respond? What essentially happened first? Walk you through it. Ask them the why. Or again, utilize Socratic questioning, you know, or tell me what you did next. How did that affect the outcome? Or again, if they're precepting, what did the nurse do next? What did you observe? What role did you play into it? Maybe it was a code and they did CPR, right? Because they noticed that the patient was pulseless and breathless. So, okay, so there's your Tanners. You can formulate that even if it's a code situation. And then, of course, reflecting or debriefing. What will stay with you? What will you keep? Or what will you change next time? Is there any, and you as the professional nurse, the instructor, this is where you can interject and talk about the textbook that they're learning from as far as evidence-based practice. This is where you can discuss an article within the last 5 years that's relevant to what they're saying or what's going on with them. Some instructors choose to uh, look at articles and print them out and bring them or show them on a tablet, whatever is allowed at your facility that would go with the day or the flow of the day or the theme of the day. For theme, and I mean by specialty, right? Um, the Lassiter clinical judgment rubric. Um, this is great if you're have a coaching mindset, okay? And you want this feedback that you're about to give them or they're going to share with you to be aligned with their with evaluation. Okay. So again, if you want to structure it somehow and say, well, let's discuss or let's talk about judgment like a skill that we build. So this has a bit of a constructivist approach to it. So it builds on prior learning. Okay. You can ask them things like, hey, during your clinical day or maybe you're doing clinical rounds, right? What what cues did you notice? Did the cues match the clinical outcome that happened? What did you prioritize? How did you communicate? What did you notice about communication amongst the interprofessionals that are there? Doctor to nurse, specialist, internist, surgeon, medical assistant, the LPN or the LVN. How did they all communicate? And then, can they reflect on it? You know, asking them something along the lines of, tell me about a specific behavior, skill, or approach that you'll move to or like to use to move up a level in your learning, right? So again, these frameworks are absolutely at your disposal. Um, You can choose to use them. Check out the links I'm going to share, okay? Your post-conference doesn't need to turn, again, let's circle back and close this loop out, right? The post-conference should never turn into a venting session about the facility, about the school, about the nurses, about your coworkers, about again, definitely not patients or fellow students. This is a way to keep structure in a time where students have everything in their hands, right? That cell phone. Okay. We should make sure that it's intentional and grabs their focus. Okay. Um, Helping the situation by picking a framework to use or even exploring a framework, because what do we do here at the Nursing Quest? We help you explore, empower, and elevate, whether it's yourself, your students, or your community. Okay. Picking a framework helps the students ask thought-provoking questions, and it essentially demands a clear overview for the next shift. Um, you know, Message me, DM me, email me if you're a clinical instructor and you want this in a printable format. Otherwise, I will have the references shared in the platform where you're watching this podcast. And remember, always help your students embrace their spirit of inquiry. And I really appreciate you watching. Thank you. Best of luck out there and be safe. Explore, empower, and elevate with the Nursing Quest.